Yeah, so you're right. 47% of Black Americans have heart disease compared to only 36% of whites, and we call that a health disparity. And so what we're doing at the Sutter Health Institute for Advancing Health Equity is studying those health disparities and the root causes so that we at Sutter can deliver on our promise to provide the highest quality care for all of our patients.
Have they been able to pinpoint yet where that disparity comes from between Black Americans and white Americans? Is it the ability to visit doctors on a regular basis? What can we point to?
So, exactly. These conditions are called the social drivers or determinants of health, and they're the conditions in which we live, we work, and we go to school. And so oftentimes discriminatory practices have led to differences in where people can live, such as more polluted areas or less safe neighborhoods to go out and exercise. We may not have the types of jobs where we can afford to buy healthy foods. And so you can see how those social drivers of health can influence our health status far more than, having chest pain and calling the doctor for that.
The other thing is resources available. You might not have the resources, minority communities available, but there are some out there. What can you tell folks who may not have a primary doctor or, just don't have the money to go to the doctor? What can you tell those folks about community services that are out there for them to get their checkups and to see how they're doing health-wise?
So Sutter Health has a tool on our website, www.sutterhealth.org, where you can find a primary care doctor that's located convenient for you. We also at Alta Bates Summit Medical Center have trusted, long-standing community partners in Lifelong Medical Center, the West Oakland Health Council, as well as Roots Community Health Clinic that provide wonderful primary care services all throughout the East Bay.
And those are for people that may not necessarily be able to have health insurance or be able to afford it outright.
Correct.
And they can do that right through this website, is find those resources.
Absolutely.
And hopefully they'll look on that website and, be a little bit more comfortable trying it out, because people might just say, hey, I can't afford it, I'm just not going to go. But there are resources out there.
Yes, there are.
All right. Dr. Stephanie Brown, thank you so much for talking with us today and providing your insight. This is an ongoing problem in the Black community that, work is underway to help solve, for sure. We appreciate it.
Thank you for having me.